but it's just better to be specific. All right, so let's whip through a few examples. So you are working in a rural general practice 2 hours from the closest major centre. Jonas is a 32-year-old male brought by ambulance into the emergency department, which you also manage. He reports sustaining an insect bite 30 minutes ago. He is wheezing. Blood pressure 84 and 50, heart rate 120 regular, rest rate 24, oxygen saturations are 98 in room air. You note lip swelling and warm peripheries. He has no previous medical history on file, and you've already called to arrange a transfer. The questions are, what is your most likely diagnosis and what is your immediate management? So let's just highlight the key information there. Rural is 32, you're in the ED, and rather than the GP clinic, had an insect bite, and then the vitals that are important are the wheezing and the lip swelling with warm peripheries, and that you've already arranged transfer. So what is the most likely diagnosis? I think everybody will know, but I've just put it in there to say that this is what I mean about be specific. Yes, this patient's having anaphylaxis, but he is having anaphylactic shock because his blood pressure is low. And he's actually, peripherally dilated as well. So you definitely would score points for anaphylaxis. And sometimes, I don't know in this exact example, but sometimes the maximum score for a question like this would be 3. Anaphylaxis will give you 2 and anaphylactic shock will give you 3. So that's why just be specific as possible. And I think some examples that are given in the ESO modules are like, that definitely we've talked about, I don't know where, but if you are in your GP rooms for this patient and it says what is the first step in management, you may say call an ambulance. But you need to be more specific. You need to say call an ambulance to take to the nearest emergency department. Or, if you're saying that, I think we'll go through examples later, but, what is the single best investigation for this patient? Not in this scenario, but in any scenario, you need to make sure that you give as much information as possible. I hope that makes sense. Okay, what is your immediate management? So I've put here, insert an IV cannula and start fluids, give adrenaline, contact the retrieval service, swab the bite site for a venom detection kit, give oxygen, and consider other medications such as salbutamol or hydrocortisone. I think you can already see where I'm going with this. We have some errors in these answers. So in the first answer, I put an and, so you can already see that that's going to be an overcoding. In the second answer, I've given the wrong dose of adrenaline. In the third answer, I've given an answer that's already in the stem. And the fourth one, it clearly says it's an insect bite. And I only put that in there because in the exam report, it said lots of people talked about management of envenomation. Give oxygen is wrong because we all know that you don't need oxygen if you're sat at 98%. And again, I've put an or in the last example there. So if I just flick back, as I've said, if you're using commas and or, think twice as you may be giving multiple answers. There we go. Good. So just to, give an example there, I think insert an IV cannula. You could say insert 2 wide bore IV cannulas. That's fine. Start fluids. Give your adrenaline. That's the right milligrams, I think, but the wrong concentration. And then you could, those last 2 answers, salbutamol and hydrocortisone, they would be correct. And I'm really unsure if you gave both whether that would be grouping. I think they're quite different because they're treating sort of different things. But another thing that I haven't put in there is also call for help. So you haven't said what staff are with you in that thing. You've just said you've already called to arrange a transfer. So you could definitely say, call for help from nursing staff or whatever you want. And we have already got observations. So I wouldn't put, you could say attach monitoring, like cardiac monitoring or something, but I probably wouldn't say, do a set of observations because you've got one right there. So when we have our next question break, just put questions in as we go because I don't know how many question breaks we've got coming up. So another example, you're called to see Edith, an 80-year-old woman who's in aged care resident at the nursing home the practice manages. She has a 24-hour history of a painful right calf. She is bedbound from a previous hemiplegic stroke. Her observations are all within normal limits. So, what single investigation would you request to confirm your diagnosis? Oh, sorry. So let's just look at the key information there. I know it's boring to do it every time, but I think it's a good habit to get into, because if you do it, especially in your KFP practice exam, if you have time when you're timing yourself to look at the key information, either scribble it down on a scrap piece of paper without running out of time for each of the 26, well, I don't think they give you 26, but for each of the questions, if you can get them done within 7 minutes of writing down the key information, I think that's a good habit to get into. But some people just don't have time, so it's just good to practice anyway. So Edith's 80, she's an aged care resident, she's got a painful right calf for 24 hours, and she's bedbound, and her observations are normal. So what single investigation would you do? And here is a nice example of how specific you need to be. So there's some examples that I've given. The duplex scan of the right leg. So what are you scanning in that leg? You can't just ask like, would you write that on a form usually? Probably not. Getting better with Doppler ultrasound of the veins of the leg, but remember which leg that you're requesting. Because although it's very obvious when you're writing it in this question, because the stem's right there, imagine yourself in your GP clinic. You're not going to write ultrasound Doppler of the veins of the leg. You need to specify, or else the ultrasonographer will not know. So the correct answer would be a venous Doppler, probably venous Doppler ultrasound of the deep veins of the right leg, and score you all the maximum points. And I think with answers 1 and 2, as I said before, it might be worth 3 points. You probably get 2 or 1 for those, but to get your maximum marks, you need to have as much information as possible. Oh, okay. So Yen is a 23-year-old female who you've seen on previous occasions. She presents with episodes of palpitations. She has had numerous over the last few weeks. She has a history of asthma, which is well controlled on Flixotide, 125 micrograms twice daily, and salbutamol as required. List 6 differential dose diagnoses for her presentation. Sorry, I just lost my. Should do. So there's the key information highlighted there. Well, probably the medications, I didn't highlight them. They're probably key as well. So let's look at some differentials. So this is one of those questions that they only give you 6 for, but there's probably, I don't know what, 20 or 30 differentials. And I've just highlighted some answers there that are examples of grouping. So lack of sleep, excess caffeine intake, they're both definitely correct, but I would say they probably both fall under like lifestyle factors. Atrial flutter and supraventricular tachycardia, or SVT, definitely are both correct, but again, they're both examples of arrhythmias. And then hypothyroidism and anxiety are also both, they're both fine. So I think in that question, especially when there's so many differentials, it would be sad to only get 4 out of 6 possible marks. So definitely write lack of sleep, definitely write atrial flutter, hypothyroidism, anxiety. Then you could say, you could put something like a structural cardiac problem. You know, if she had cardiomyopathy or hypertrophy, that's different to an arrhythmia because that's a structural problem. So I think you would still score points for that. And then you could write medication. So your example of medication that causes palpitations, there is multiple. So don't just write medication, write an example of a medication if you know it. And I think although you could consider sort of like illicit drug use as a lifestyle factor, I think that's different enough and significant enough to fall out of the category of lack of sleep and excess caffeine. You could put, so she could have, she could be significantly underweight, so you could have a BMI less than 16, You could have pregnancy. She's a 23-year-old. She could definitely be pregnant. So there's multiple answers, and I think it's just such a pity if you obviously know all that, but then not lose marks, but then don't get your maximum marks for grouping.